Okay, we're gonna put our camera on. Stop the share.
They've lost a couple of providers there.
They kind of want to embrace you and probably the administrative stuff.
Okay, we're going to get started. I'm Chris Casalunas with Covell Consultants, and John Romero is here from Blue Cross. We're going to start with some general information about Medicare, and then John is going to go into some details of the Blue Cross plans. We're a relatively small group, so please, if you have questions, put them in the chat and we'll answer them as we go along. So all of you, you probably remember how you got here. You either turned 65 or you got Medicare by way of disability. This slide is primarily to identify for you that Part B premium is going up to $174.70 in 2024, a $9.80 increase from last year. I like to alert people to the income-related monthly adjustment amount. So Medicare does a 2-year look back at either your single or married filing jointly income. And so $174.70 with a $0 additional for your Part D is the foundation. And if your income is higher than $103,000 as of 2 years ago as a single person, or $206,000 as a married filing jointly couple, you are going to have a higher Part B premium, and you're also going as your income related monthly adjustment, and you're also going to have a Part D income related monthly adjustment amount. And so even if your plan is a $0 premium plan, that means if your income, let's say as a single person, is above $103,000 but below $129,000, you are actually going to have to pay $12.90 for the income related monthly adjustment amount. So all of you have, if you already have a Medicare Advantage plan, you've already passed your initial enrollment period around the time you turn 65. For some of you, that initial period was after you left employer coverage. And then every year, there's the annual enrollment period. It's the same dates every year, October 15th through December 7th, where you can make a new choice that becomes effective January 1 of the following year. During the annual.
So I'm going to interrupt here just for a second. If you have questions, you guys are all muted, so you can unmute yourself to ask a question, or you can put it in the chat. And if you put a question in the chat, we'll catch it on the chat, and then we'll let Chris know that you're chatting. So we're monitoring this from a back room, but if you want to interrupt or you have a question as we're going through, you got to unmute to ask the question.
Yes, and I had told you just to put it in the chat. Actually, yes, that will work as well, and maybe will be easier for you because there we can have a back and forth if you unmute yourself and ask a question.
And we will save the chat questions, and we can send them out if somebody wants answers.
Okay. And so during the annual enrollment period, you can actually make multiple choices. And then the last choice that you make by December 7th is the one that sticks for January 1 of the following year. We're right now in this period called the open enrollment from January 1 through March 31st, where you can make one change from one Medicare Advantage plan to another Medicare Advantage plan. And that change becomes effective the first of the month following when you make your change. And you can also during this time return to original Medicare. Perhaps you're still in your guaranteed issue period for the Medicare supplement, pick up a Medicare supplement and enroll in a PDP. So there are also special enrollment periods. Sometimes people worry, oh, I'm moving to Texas. next month. If you move, you always have a special enrollment period to choose a plan that works or is effective in the place where you move. If you lose your current coverage, so if you're working and you leave work, that's a special enrollment period, a 60-day special enrollment period, get a chance to get other coverage. You get employed, your spouse gets employed. Your plan changes its contract with Medicare. That usually happens on calendar year rather than mid-year, is my understanding. And other special situations, the primary one is if you qualify for extra help or some level of Medicaid, then you have quarterly special enrollments throughout the year. The fourth quarter, your enrollment period is still the annual election period. So I always like to talk about the low income subsidy because it is so important for people who qualify. And if you qualify, if you want it, it can't hurt to apply. And Mark Covell and I are happy to help you with that, or any of our downstream agents. If any of you are on the on Zoom who were enrolled by any of our downstream agents. So the low income subsidy helps pay the Part D monthly premium. And so that could be a portion of your MAPD premium. The deductible, coinsurance, and co-payments are reduced. You also don't experience what's called the coverage gap, where your costs for prescription drugs are higher, 25% of the cost. So in 2024, so the subsidy, let me show you this chart. So if you just have Medicare, so this is for the low income subsidy, you can have income up to, as an individual, $1,843 a month, couple $2,485 a month. And that amount includes $1,500 toward burial expenses. If you apply directly through the low income subsidy, there's also an asset limit where individuals can have up to $17,220 or a couple $34,360 in assets. This doesn't include your house, your home. This is savings checking account. So there's also Medicaid for people with Medicare, and that's called the Medicare Savings Program. And why this says Medicaid with or without, so you could also, if you're very low income, qualify for Centennial Care, but you also should apply for what's called this Medicare Savings Program, because the Medicare Savings Program is what picks up your Part B premium, which can be a good help. And if you apply through for extra help through Medicaid, you're automatically enrolled in extra help. And New Mexico Medicare Savings does not have asset limitations. And so sometimes that's a better way to go in. And you can see that your costs, you're going to pay $0 premium and deductible, because some plans have that $545 deductible on tiers 3 through 5. And so if you qualify for the low income subsidy, you're not exposed to that deductible. And then your co-pays depend on whether you're above or below the 100% of the federal poverty level. Any questions on that?
Where would someone apply for LIS?
So you can apply online. I just Google extra help application online, and you can do it that way. That works, but there are asset limitations. You can also apply through YesNM, which is New Mexico Medicaid, and be sure to apply for help with Medicare premiums, which is different than health insurance, right? Okay, now we're getting more Blue Cross specific. So Blue Cross has both HMO plans and PPO, Medicare Advantage plans. So Loveless Hospitals, the Heart Hospital of New Mexico, St. Vincent, UNMM Hospital, UNM Sandoval Regional Medical Center are the hospitals in network for all Blue Cross Medicare Advantage plans. If you have a PPO plan, PPO plans also include Presbyterian hospitals. For urgent care, there are a number of urgent care centers, Concentra, Duke, GNM, NextCare, New Mexico Urgent Care, and more. Again, the PPO plans only include Press Now. John, could you speak to that? So people are told they can go to any urgent or emergency care. Is that out of network? So somebody has a Blue Cross HMO plan, should they not walk into Press Now?
So it's kind of tricky. So what they determine, like what's a true medical emergency. So I mean,
Okay,
it's based off of how it's submitted to Blue Cross Blue Shield. So if you go to urgent care and you end up having allergies, the diagnosis that they're going to bill that is not an emergency. So that's something that could possibly fall out of network. So I mean, of course, if it's a true emergency,
go to the
go to
closest.
go to the nearest emergency or urgent care if you feel it is a true medical emergency. But
Okay,
that's how we would determine that.
okay. And then I've added on this slide, do not use Albuquerque ER and Hospital on Montgomery. So this relatively new facility does not accept Medicare or Medicaid. They do accept commercial plans. And so we've had a few instances where Medicare Advantage members went to Albuquerque ER and Hospital and they didn't accept their card. They felt they had already waited whatever period of time. And so they were charged $3,000 and thought they could be reimbursed by their Medicare Advantage plan. You won't be reimbursed by your Medicare Advantage plan, or you'll be reimbursed some very small portion of that. A recent person, her reimbursement on a $3,000 payment was going to be $116 is what Aetna determined was her responsibility. And there's just no recourse. So if you can avoid it, just do not use Albuquerque ER and Hospital.
Chris, is that the same one that's also on Coors and Paseo?
I don't know. I just know about this one because I've driven by it many times. Have you had any issues with this, John?
I haven't heard of that one come up. No.
Oh, so I've had a Humana member and an Aetna member who are like, I got charged and what can I do? And
Yeah.
because they say they do not take Medicare. And so then they won't follow the Medicare rules about Medicare reimbursement. And so people end up paying a lot of money.
Yeah. I'll have to look into that because I haven't run into that issue myself, but I'll clarify with our team on like how that would work on our plans for sure.
Okay. Any questions before we move further along? Okay, so now we're getting into the Blue Cross specific. I'm going to turn it over to John Romero, sorry. I don't know. And so it's the middle one is the phone.
All right, so good morning, everybody. Thank you very much for having me. Thank you for all the members for being our members this new year, or if you're continuing Blue Cross Blue Shield members, we definitely appreciate it. So we had a lot of, so I pushed the middle one.
I think so. Is it working? Oh,
Maybe.
so just click in here. Oops. Oh. Let's see. Oh. Sorry. I don't know what happened.
I can use the mouse if that.
Okay, so do you want me to go back?
No, I mean, the last
Okay.
one, it was just, so my name is John Romero. I'm with Blue Cross Blue Shield.
It was working for me.
I'm the regional sales manager, so I work with wonderful brokers like the ones here. I'll let you guys work on that first.
Sorry, we're having trouble with our,
No, you're fine.
our,
You may have to run it with the
The mouse?
mouse.
No, that's fine.
Huh.
Figures, I come in and I break it.
Is the mouse working?
Yeah, no, this is working fine, so I can just use this. All right, so today what I'm gonna do, I'm just gonna go over some of the basic or some of the additional benefits that a lot of members, just to remind everyone, a lot of people forget about the additional services that they have available, such as the 24-hour nurse line, care coordination, some of the new benefits that we added this last year, such as the flex spending card, where you can use $1,000 on dental, vision, or hearing services. Some of the dental allowances that we embedded into our plans, some of those extra things there. Oh, let me see. Sorry. I think it skipped itself there. All right. All right, so Chris already kind of went over this, but like our network, we have a very broad network with our PPO products, of course. So in this Albuquerque metro area, in the surrounding counties, we have all 3 major hospital systems. The same thing goes for southern New Mexico, so Las Cruces, we have all 3 major hospitals out there. Another thing I always like to touch on is on our PPO products, you do have access outside of the state of New Mexico. So if you go to a provider that has a Medicare Advantage PPO contract with Texas, their local Blue Cross Blue Shield out there, or even California, these benefits will follow you on your PPO products. So you
That
have.
would be considered in network.
Yes,
then?
in network, yeah.
Mhm.
So you would have in-network benefits outside of the state of New Mexico with those PPO plans. No questions asked. You don't have to call customer service, get authorizations or anything like that. You just want to make sure that the provider you're going to in that other state does have that contract with their local Blue Cross Blue Shield. So some of the additional benefits or some of the plans, what you'll see on there is that they have a $0 copay for PCPs. Some of our plans have some of the lowest specialist copays that you'll see out there in the market for MAPD products. Some of these are kind of repetitive, so I won't cover everything on the slide because I think it's like when I go like this, it moves.
Oh, yeah, it does.
and then we're gonna try this again.
All right, let's maybe,
Get back to where,
I move my
Can I,
hand.
can I ask a question?
Yeah, of course.
Can we get a copy of this presentation? It just helps because you're going to be scrolling through it and I'm going to end up wanting to copy everything down so I don't forget. But it's nice to have this information electronically. Would that be possible?
Yeah, I'm sure that Chris is
Yes.
gonna send that out to everybody.
well, yes, so please, send your email in the chat.
All right, thank you.
We'll send it to you. Oh, you're going,
I know, I was going the wrong way, I think.
yeah, okay.
All right, so this, yeah, there we go. All right, so for 2024, we did enhance all of our Medicare Advantage products on the prescription side. So the formulary was enhanced, so we covered a little over 300 additional prescriptions on all of our MAPD products. So if one of your prescriptions, if you're a member with us in the past and one of your prescriptions wasn't covered, definitely go and check that formulary again, see if those prescriptions are now covered. Because like I said, we did enhance that formulary for our members.
Were there any particular drug categories that you enhanced that you know of? Like, what about insulin products?
No, so I mean, well, the insulin, we did have that new copay cap where it's gonna be capped at $35 for the 30-day supply. But as far as like insulin drugs or anything like that, I don't know. if
That
we
they didn't
added-
change.
Yeah, we didn't
Okay.
change. But I mean, we do have a pretty broad network, for the prescriptions that we cover on the insulin as well. Most of those drugs, I think they're kind of spread out. I think they're more like in the tier 1, like the generic drugs, and tier 2, those additional 300 prescriptions.
And one change, I guess, this year with all the plans, right, is that shingles is now covered at zero copay, right?
Yeah, so you have a $0 copay for things like the shingles.
And that tier 1 in the gap means that
the tier one drugs, if you get into the gap, the tier one drugs are still what they are if you were out of the gap. Is that what that means?
Third dot down.
Oh, okay. For 30-day supply of tier one drugs for preferred network pharmacies. No, I think that one's just referring to,
The one right above
It
that.
says most Medicare Advantage plans include tier one in the.
oh, okay, yeah, sorry, I was reading the wrong one.
Yes.
Yes, that's right. I was like, no, not that one. Yeah, so no, that's correct.
Okay.
And so we have a pretty broad network for our pharmacies. So the most popular ones on the preferred network are going to be Albertsons and Walgreens. So you'll see that across the board with our plans. Those are the two most preferred. Some of our other products, they do have a bigger network, like the Select HMO plan. It'll have options for Smith's, Walmart, Safeway, other independents, that you have a preferred option. And what that means is, so when you go to a preferred pharmacy, that's where you're gonna pay the lowest out of your pocket. So if you go to like a standard pharmacy that's not on the preferred list, you can still go there. You're just gonna have to pay a little bit more on your copays, which, I mean, if you prefer to go that way, you can.
So most of the PPO plans, Albertsons and Walgreens are the preferred pharmacies.
Yeah,
That
exactly.
caused a lot of problems.
What is that?
That caused a lot of problems for me and my customers, because they either don't have access to Albertsons and they don't like Walmart, so they were left at Walgreens.
Walgreens? Okay.
So why did they only restrict it to certain plans that they can only use Albertsons and Walgreens?
That's a good question. I mean, that's something we definitely asked ourselves. Of course, we don't make those changes. We do come back with suggestions like that helps. If we're hearing a lot of that, like the pharmacy, we want to expand the network. Like why did we narrow it on some plans? So something that we're looking at for the future to see if we can just get all of the plans on the
Exactly.
same preferred network. Because it only benefits our members,
Right.
us,
And
the brokers.
particularly outside of the metro area, right?
Yeah,
So
for those
Tony is
areas.
talking about East Mountains, people, the Walgreens is difficult out
Right.
there and people like to use Smith's or Walmart.
Yeah, or for convenience, I mean, they're already in a Smith's possibly doing the grocery shopping,
Exactly.
the pharmacy's right there.
Yeah, it's a $15 per prescription. You get people taking 7, 8, 9 prescriptions at $15 extra.
Yeah.
To go to Walmart, gets really
It
pricey,
adds up really quick, yeah.
and they will not make exceptions on it.
No, not when it comes to the preferred network.
But your two best plans, Choice and Classic, are both governed by Albertsons and Walgreens.
Yeah. Yeah, so, I mean, that's something we'll take back. We want to try to enhance these products as best as we can. We've made a lot of changes and enhancements, and I think that was one of the only things that I seen that's kind of, in a way, a negative for some members, but I mean, Walgreens and Albertsons is really popular. They're on every corner for the most part. I think there's over 20 Albertsons across the state. I don't even know how many Walgreens there are. I mean, I see one every block that I'm driving, so. But I mean, there are all those members that want to use the other locations, so we'll definitely look into
Well,
that.
I'd like to support that as well. I've had terrible experiences at Walgreens. I go to Smith's, they by far, it's a smaller pharmacy, and so they pay more attention to you as the customer and the actual drugs you're going to get. And they've gone the extra mile to get what I need.
Yeah,
And you're not going to get that at Walgreens. They don't care if you live or die. They care if you can hand them the money and pick up the drugs and go.
yeah,
So I'm just adding my 2 cents as a customer. I don't think Walgreens service deserves to be, deserves to make it into this elite club.
yeah. No, well, thank you very much. Like I said, we definitely, like the way we enhance our products, the way we make these changes is the feedback that we get from our brokers, who in turn got that feedback from our members. So hearing that firsthand from you, one of our Blue Cross members, definitely helps and goes a long way. So like I said, I'll definitely take that back, and it's something that we have tried to address. Hopefully it's something that can be changed in the very near future for you.
I would agree with what she said. There are Walgreens and there are Walgreens.
Yeah,
If you pick the wrong Walgreens, if people don't care whether you're even in there.
no, well, thank you again. I appreciate it. Appreciate the feedback on that. So some of the additional benefits that you'll see on your plan, in 2024, all of our plans, we embedded the hearing aid coverage on all of your policies. So you'll see like before there's like a buy-up option for the hearing aids. That's all embedded now. So you'll pay a flat copay of it, either $699 or $999 per year. I have to do it that way. It's a tongue twister. But you'll see that on all your plans now in 2024. A lot of your plans are going to have dental benefits embedded into it as well. You definitely want to look at your summary of benefits to see how your coverage, how it works out. I don't want to go into too much detail just because I don't have like a screenshot of this, but any plan that you're on, like if you have the option to buy up for dental, those plans do not cover full comprehensive dental. The plans that don't give you that option, like the
Flex.
the flex,
Oh, Flex gives you an option to
the
buy.
health choice. Oh, no, yeah. No, sorry, the health choice, the dental plan, of course, which is $5,000 of embedded dental, and then the select HMO. The select HMO is a very popular plan. So if you're on that one and you have that $2,000 of embedded dental, that does cover comprehensive, which comprehensive is dentures, bridges, and crowns. Vision, you'll see vision as well embedded in your plan. Most of those are like $150 for your hardware, covers routine vision exams as well.
Can I ask about IMED? So on a PPO plan, if someone gets their glasses from Costco, can they submit for a reimbursement up to whatever the allowance is in their plan to Blue Cross?
For vision?
Mhm. If they go out of the IMED network.
If they go out of I'd have to check on that actually, because I think the IMED, so on the dental side, it is a PPO product, so you have out-of-network benefits. On the vision end, I'll have to see about that and see.
Because I've
if they
had
can
people
submit
ask me
reimbursement.
that
Yeah.
before. Mhm.
No, that's a good question. I can take that one back as well. So the vision, the question was whether you can go to an out-of-network provider. I'll have to send a follow-up on that. On the dental, it is PPO, so you do have in and out-of-network benefits.
Unless they're on an HMO plan.
Even the HMO, so the
Oh.
HMO, it gets confusing. So the dental is a PPO product across the board.
Okay.
Yeah, it's Dental Network of America. True Hearing, I've actually called True Hearing for members before. It's very easy. I thought at least, I mean, that was my experience. So if you do need hearing aids, you would call True Hearing. They would help you find a provider within your zip code, help schedule the appointment, and then let you know what you're gonna pay for your hearing aids before you even go in. I mean, I spent 5 minutes on the phone call, got through to someone right away. So it's a very easy process. So if you do need hearing aids, that's who you would call as True Hearing.
So do you recommend, or would we recommend to our clients that are new to Blue Cross, the best way for them to access these benefits would be to call those phone numbers? Is that the easiest way for them to find a dentist that's in their network or to? Okay.
I would say so, yeah, and that's why I have these phone numbers here. I think it's the easiest thing to do. That way there's no confusion on what dentist is in or out of network. Same with True Hearing, like I said, they schedule the appointment for you. So it just makes it so much easier for those members.
And if a dentist is showing up on the provider lookup, but then is telling members, I am not in network. And I even called this dentist, I am not in network.
Right.
Is there any recourse?
I mean, it would be probably just call our customer service, which that number's on the back of each member's ID card. But what I run into, because I've had to call dentists myself, like 3 or 4 at least, and they get confused on what network they have. So a lot of members go, well, I have Blue Cross Blue Shield, you're contracted with my dental, and the dentists, they don't like put it together. So they're like, no, we're only contracted with Dental Network America.
Oh, so it's more misunderstanding. So
Sometimes,
would you
yeah.
say that's probably what it is if they're in the network?
I would say so. I mean, based off of my experience. So make sure when they go in there, I have Blue Cross, my coverage is under Dental Network of America. That way that dentist knows, like the front desk or receptionist that they're working with. I think that's what it is, just some kind of like miscommunication or misunderstanding. Because when they hear Blue Cross Blue Shield, they think about like Medicaid maybe, because we have the Medicaid contract. So that's separate, it's through DentaQuest. And so there's confusion on that, like we have DentaQuest for Medicaid, Dental Network of America for Medicare. So they sometimes can get those things mixed up on who they're contracted with.
But members of the Blue Cross D-SNP plan have Dental Network of America.
Mhm. Yeah,
Okay. And then I had a question about the transportation.
yeah,
So I know transportation is only on the select plan, is that right? The HMO select?
yeah, that's our only MAP.
And so people from time to time have said, nobody came to pick me up. So
Okay.
then what are you hearing this year? Because I haven't heard it this year.
Okay,
What should somebody do if they have an appointment they really have to get to?
yeah,
And I imagine it's the same problem for the transportation, that they can't get drivers, all
yeah.
that kind of thing.
I haven't really heard of that happen in myself, but I mean, definitely the members, they want to call in and schedule those transportation visits at least 72 hours in advance.
Yes,
At the earliest, just because, I mean, if you try to do it the same day or day before, those appointments more than likely aren't gonna happen, or there's gonna be issues with it. But if they ever do not get picked up and they scheduled it on time and everything, they definitely, well, the brokers would wanna come to me and let me know, hey, this happened, that way I can look into that immediately. But for the member, they can always call customer service as well and have them look into it also.
John, that brings up an interesting problem. Having contacted you in the past, sometimes you're hard to get a hold of, and I know you're extremely busy.
Yeah.
Do you have a backup?
So there's 3 of us on our team. We're a very small team. So it's Robert Watson, who's the, I guess you can say, director of Medicare, myself, and then Jessica Rivera. So, I mean, if there's ever anything, like if you want to reach out to us, send all 3 of us an email. Because like I said, we are a small team covering like 1,500 brokers. So, I mean, it is possible that, I mean, we don't get back to you right away. But that's what I would recommend doing, is just reaching out to all 3 of us.
By email?
By email or by phone call, yeah.
Okay.
All right, I'm gonna back up. The great thing about having a back office that's monitoring all this and double checking, making sure that Tony's not going off track here. But, so I was looking at the vision. So on the Blue Cross plans for vision, if you're on an HMO plan, you have to stay inside of the network for your vision plans. Your PPO plans do have an out-of-network benefit for the vision.
oh,
So
Nice.
anyway,
Thank
I'll
you.
go back to my hole now. And continue to monitor, because we're looking stuff up, making sure that if somebody doesn't have an answer, we're pulling it up back there.
Awesome. No, that's
So,
great.
anyway.
Thank you, Mark.
And John, do members just use their one card for any of these additional services? They use their they don't have,
Yeah, they don't have a
Worry about it
separate
next
card
time.
for everything. They should have it all on just their one Blue Cross Blue Shield card.
John, with the transportation, is there flexibility? For example, I know there's usually a mileage limit per trip, but what about people who are plan members in a rural area? Their mileage, obviously, to get down to a major medical center from
Yeah,
like the East Mountains is going to be, just one trip is going to be more. Is there flexibility in that?
yeah, no, that's a good question. The question was on our transportation, if there's a mileage limit. So we're one of the carriers that do not have a mileage limit on ours. So we had a member that was traveling, they had to go from Deming all the way to Albuquerque for a doctor's appointment. And so they were able to get that transportation. So again, there is no mileage limit. You don't have to find a ride like halfway back or anything like that. So no, thank you. That's a good question.
and so the transportation provider how does that work in Deming? Like, who's actually doing the driving
Actually doing the driving, yeah.
from Deming?
I
A
mean,
contracted driver?
yeah, just like contracted, like a vendor that we use through, well, the transportation's through Logisticare, so that, I mean, they're the ones that coordinate that with like the drivers that they work with.
Oh, okay.
Yeah. And this is a whole lot of information here. So the main thing I wanted to just display on this is mail order. So on the mail order pharmacies, you do have 3 options now. We added Amazon now in 2024. So if you do want to go the mail order route instead of going to a pharmacy, especially for rural areas, you can get your 90-day supply delivered to your home. So we have Amazon, we have the Alliance, and then we have the,
The preferred cost.
yeah, it's a preferred mail order. And I won't cover any of this other stuff. That was the main thing. This was the only slide that had that. We kind of went over the hearing aids as well.
Could do the blue card program.
Yeah.
That's important. I
So the blue card is what I kind of covered on the PPO side. So blue card is how you're able to access providers outside of the state of New Mexico. So on a PPO product, you can go to a provider that has that contract with their local state. So whether you're in New York, Florida, wherever it's at, as long as you see a provider that has an MAPD PPO contract with their local Blue Cross Blue Shield, these benefits will follow you, and that's what blue card is.
Oh, so blue card is not the travel benefit.
No.
So is there still the travel benefit for HMO
Yeah.
members?
Yeah, so there is still, if you're on a HMO product like the HMO Select, which was probably our most popular plan this past year, you do have a travel benefit. So if you're traveling outside of the state of New Mexico for 10 or more days, up to 6 months max, you can actually call into our customer service and get that, like a pre-authorization for you to be able to have your in-network benefits follow you. So that's not just emergency care, that can be specialty care, like regular hospital visits, whatever it is. If you're traveling to Arizona for 10 or more days, your in-network benefits can follow you on the HMO plan as well.
And 2 weeks in advance, do they need to call?
Yeah, I would say at least 2 weeks in advance, 10 business days, just to make sure that you have that all set up and ready to go. Because you don't want to do it when you're already out in Arizona or Florida, wherever you're at.
But once they're there, they just use it as if they were in Albuquerque.
They have to
Yeah.
show the so how does that work? Do they have to show the letter? First, they would have to find a Blue Cross
Yeah.
in-network
Yeah, so you would have to
PPO
find.
provider?
Yeah, so you'd have to find an in-network provider first, and then once it's approved by Blue Cross Blue Shield on the customer service side, then those benefits can follow you.
So there's getting the letter and then there's getting a further approval. Is that what I'm hearing?
Yeah, so it does have to be like approved from the customer service side, which I've never heard of it being denied. It's just like a process that they have to go through. So yeah, it's basically just getting an approval letter that you can use your benefits outside of the state. And then you would show that to your provider whenever they help you find that contracted provider as well.
And does that letter have a time limit on it? Like, is it for 6 months or, sometimes you get snowbirds that are going someplace.
Yeah, like Arizona or
Arizona
something.
for the whole winter. Is there a time
Yeah.
limit on that?
So normally, like the pre-authorization, they would ask like, well, how long do you plan on being out there? So you're gonna start from that 10 days going forward. So I'm gonna be out there for 2 months and then they'll approve it for that time frame. If you need to extend on that, like if you're gonna stay on a little bit longer, then you can just call customer service and get that extended.
If with the PPO product though, if they say you're in Arizona, you just go online and put that zip code in or whatever, and you just don't need.
Exactly.
Okay.
Yeah. So for the PPO, you don't need to call in, just find a contracted provider and you're good to go. So this is just talking, that's the travel benefits that we just brought up, 10 days up to 6 months. You do have worldwide emergency coverage as well for both of our HMO and the PPO. I will touch on that just a little bit. I mean, I don't want to get into too much, but basically when you're traveling and it's an emergency, it is based off of a true medical emergency and it covers you up until the point that you are stabilized in that emergency situation. So like if you're out of state on an HMO plan and you didn't get like approval for like a travel benefit, then that plan would cover your emergency services. But as soon as you're stabilized, then those other services may process at the out-of-network level, like if any additional inpatient or physical therapy care.
John?
This, yes,
Excuse me, I was just thinking along those same lines. Let's say that someone is, a member is out of state, something unanticipated happens, but at some point they need to come back here. But they need maybe transportation that's not conventional. How is that covered on the plan, or is it covered?
transportation
Yeah.
from there back
Sure,
to the
let's
state
say
or
that,
something. for
sure,
example.
let's say that you're in Arizona, you get sick,
Yeah,
and whatever the injury is or something of that nature, you need to come back to New Mexico, but transportation's an issue. You can't go by car. Maybe you can go by
Yeah.
ambulance. Is that picked up in any way or?
no, so the question was on transportation, like if you're in Arizona and you need to be transported back to New Mexico for an emergency, well, just after your emergency, that part wouldn't be covered. So the only time that it covers transportation is if it's a true medical emergency. So if you're in Arizona, like maybe in a rural part, and they're transporting you to the nearest, they're gonna transfer you to the nearest hospital. That's the transportation that's covered for that emergency situation. But if you need to get back into the States, like you're out of the country or just in another state, you would probably want to look into like some other like travel type insurance to cover
Right.
that.
And Cobell Consultants does have offer travel insurance on our website.
Awesome, there you go.
And we recommend it because also the worldwide coverage on a Medicare Advantage plan, you have to pay out of your own pocket
Mhm.
for the entire procedure, whatever you need,
Yeah.
and then you submit it, if you just have Medicare Advantage, right, to your
Yeah.
Medicare Advantage plan for reimbursement, and it can take months and
Right,
months.
yeah, exactly. On this, do you have anyone that's on a flex plan or do you want?
Many,
to-
well,
Oh.
I don't know about online,
Okay.
but yes,
Well, I'll still cover it. So, the Flex PPO plan, we call it our Medicare supplement lookalike. It mimics a Plan F. So basically, you're gonna pay a premium on this. This year is $197 a month. And so when you go to the doctor, there's no copays, there's no deductibles, there's no out-of-pocket expenses for you on the medical end. So you can go to any doctor or hospital, as long as they accept Medicare assignment and they're willing to bill to Blue Cross Blue Shield, you don't pay anything out of your pocket. The benefit of this is there's a lot of people on a Medicare supplement that pay over $200, even $300 a month for a Medicare supplement and a Part D, which is the prescription drug plan. This has it bundled into one plan because it is a Medicare Advantage plan. So that's the biggest thing with this. Again, you don't pay anything out of pocket for your medical. The prescription side, you do have to pay like the normal copays and the deductible fees. But a very good option for anyone that was on a Medicare supplement and wants a Medicare supplement without the price attached to it. And kind of the same thing I just said, can go anywhere that accepts Medicare assignment. They're willing to bill to their local Blue Cross Blue Shield. So if you're in any state, this plan will work out there. You do have benefits for telehealth services. So if you don't want to go to the doctor, allergy season's right around the corner. So if you don't need to go to the urgent care and spend $50 copay or whatever it is, you can get the telehealth services as well, where you can be treated for those type of things like allergies, asthma, maybe it's a slight cold or whatever it is. You do have that option on your plans. Silver sneakers, I'm sure everyone's aware of what silver sneakers is. All of our MAPD products do have this embedded into your policy. If you are not sure like what your ID number is for that, you can log into Silver Sneakers and print out like a temporary ID card to use at the gym. They have tons of gyms on there, whether it's Choose Fitness, Planet Fitness, I think Defined is on there as well. There's even online classes that you can take advantage of for no additional cost. So it's definitely a great benefit. We want to make sure our members are taking advantage of these type of services. The rewards program, this is something that's embedded in all of our plans as well. Basically what it is, like when you go to the doctor and you get a routine well visit, a flu shot, mammogram or anything like that, you actually earn $25 gift card up to $100 per year And it can be anywhere to like Barnes and Noble, Walgreens, Walmart. A lot of people they have this money outstanding. It's just out there, just waiting for you to select your gift cards. So if you've had services like this done, you definitely probably have some gift cards waiting for you to be selected. So if you go to this website at the bottom, which is bluerewardsnm.com, you can actually use your member ID number. That's how you create your account. And then you can see if you have any gift cards waiting for you.
And the rewards expire at the end of a calendar year, is that correct?
Yeah, so it is calendar year. So if you didn't use it in 2023, unfortunately, those are probably gone. But for 2024, you can get a jump on that and start earning those gift cards.
So are you saying people don't, because I've had a couple questions about that, they don't have to sign up and then log their activity, it's just gonna happen automatically?
Yeah, so the way this is tracked is actually through our claim system. So whenever you have one of these services done, we track it on the claims and then it gets added into your Blue Rewards account. And if for any reason it wasn't loaded, you would call customer service and let them know I had a mammogram on this date, and then they can go and like add it to the rewards.
And I'm assuming there's more than those 6 items.
Yeah. Yeah, I mean, if you were to log in right now, I think there's like a health risk assessment that you can complete. Takes like 5-10 minutes, and then that's an easy $25 that you'll earn.
And so does Blue Cross also call new members to do a health risk assessment? Is that something new members can expect or not?
Yeah, I mean, we do have a third-party vendor that would actually reach out to our members. It's usually by phone call, but they'll send you mail. I knew a few that actually got a text message. So there are those things out there.
And so if you did that survey, does that count towards your rewards, or then you can do the health risk assessment yourself?
No, the one on the website is a little bit different than what you're gonna get the call on. It's really basic, and then, yeah, I mean, there's nothing additional that you need to do to earn that $25.
Nice.
Yeah. Over the counter, so over the counter products, these are those products that you can purchase through a catalog right now. We are looking to add a card, hopefully in the near future for next year, to where you can go pay for these in store, whether it's Walgreens, Albertsons, CVS. We did add that to our dual plans. So if anybody is on a dual plan, which is you had Medicare and Medicaid, we do have a flex spending card, and we embedded the OTC benefits, the allowances into those cards. So you can use a card with the dual plans. All of our other standard MAPD products, you do have to use the catalog. And so this is how you would access that. You would go to mybluenm.com, and that's where you can place your orders for things like Tylenol, vitamins,
Band-Aids.
Band-Aids, you name it. There's a ton of products out there.
And Blue Cross, that allowance, quarterly allowance rolls from quarter to quarter
Yes.
through the calendar year. So that's different than some of the other carriers.
Yeah, so your OTC benefits, they do not expire every quarter. So like for example, if you're on the Choice Premier, you have $100 per quarter. That'll roll over every quarter until the end of the year. Just make sure you use it before December 31st.
Which is true for the others.
Okay, on the chat, we had a question about MD Live. Somebody said they went to MD Live and MD Live said they don't accept Blue Cross Blue Shield.
Oh, wow. MD Live, that's something I'd probably have to look into, maybe get their information and try to follow up with them on that
Okay.
to see what's going on.
So whoever sent that question in, if you will send us that information, we'll get it to John and we'll have it looked at and get it figured out.
Yeah, no, thank you. Yeah, if ever you have issues like that, I mean, you know you have these benefits or these services, and through MD Live, definitely call customer service or let your broker know, and they can let me know. I mean, that's important. We want to make sure our members are being taken care of and have access to the services that you have available to you. The Blue 365, this is a lot of people don't know about this as well. I kind of consider it like a Groupon. So it's more like a a discount that you get discounts for different things such as like Reebok. I don't think Nike's ever been on there, but there's like vision services that you can get, like a $50 copay for a vision exam, or maybe cheaper contact lenses, whatever it is. But I mean, there's some other examples on here. So this isn't like a benefit that's embedded into your plan. This is just something extra for all of our members that have a Blue Cross Blue Shield product. So if you go to this website, it's mybluenm.com/blue365. If you go to that website, you don't need to do anything like create an account. Basically, you have access to these discounted, I don't even know what to call them. There's so many different things on there. But just definitely go and take a look at that. Just see if there's anything that interests you.
Do people have to put their ID number so that the site knows their Blue Cross or not? Did anybody go to?
I think it'll give you like, yeah, I think so when you go, yeah, I think you do have to create an account still, just so you can like place your orders. But I mean, if you go on the website now, you can just kind of see like what options are out there right now. So some other resources for members, definitely want to make sure everyone's taking advantage of like Blue Access for members. That's where you can go and track your claims. You can print new ID cards if you need to, request new ones, change your address, look up providers, whether it's dental, vision, or even medical.
So members with their ID number can create a Blue Member NM account and get a PDF of their ID card, but brokers can't
No,
do that.
that's correct.
Okay.
Yeah, so members, you can log.
That's very useful to know.
Yeah. So members, yeah, if you go onto your, you go to create an account using your ID number on the front of your card, you can print out a temporary ID card, a PDF version, and request a new one as well. You can also set it up to where you get text messaging. So like when a claim is processed, you went to the doctor, once it's processed and submitted to Blue Cross, you'll get an alert, just telling you to go check your Blue Access for Producer portal. So I mean, it's a really good tool for our members. Definitely want to make sure everyone knows how to use that and take advantage of that. Again, Provider Finder, that's where you can find all of our contracted providers across the state, even outside of the state, as we mentioned with our PPO products. You can also do cost estimates. So a lot of people, even a lot of brokers, don't know that we have a prescription cost estimator tool. So if you go to this prescription drug estimator, you can plug in all your prescriptions. It'll give you a breakdown for the full year of like what you're going to pay, when you might hit that coverage gap, or just to see if a prescription's even covered under your plan. The CAP survey, this is something we always want to let our members know that these are going to be coming out. And then, I mean, these are random on who gets these, but basically the CAP survey is something that was sent out to members. And this is what helps us improve our plans, whether there's issues with providers, timeliness of appointments, health issues that aren't being addressed, like by our care coordination teams, which they definitely want to stay on top of. So when you do get that call from care coordination, definitely be honest and open with them. That way they can help track your, like whether it's high blood pressure or diabetes. We want to make sure our members are healthy and those things are being taken care of. So the CAP survey, definitely be honest with these things, but I mean, make sure it's addressed to like if you're having issues with like providers or anything, that's what this is for. But it's like, for example, if you had an issue, I don't know, you couldn't log into the website or an ID card, you didn't get it. That wouldn't be for this survey. You don't want to give a bad review on these CAP surveys for something like that, because that could affect your plan in the future. So just a heads up that you would expect to get those in the mail around March 7th or March 13th. And so this is an example of what your ID card looks like here on the right-hand side. You should have received that in the mail, your welcome packet, the welcome communication, which has like summary of benefits, star ratings on your plans, member value statements. And I think that's basically, well, If you're on a plan that has a flex card, you would get that separately. So make sure you definitely check all your mail. If you should have a flex card, again, that's $1,000 that you can use on dental, vision, or hearing services. And it's a white prepaid MasterCard.
Right, and that's only on the Choice Premier PPO.
Yes, so it's on the
Health Choice, sorry, it's the Health
Yeah.
Choice, right.
Yeah, Health Choice PPO, and then the Select HMO will have
And
the flex card. And the duals.
Oh, and the dual, right.
Yeah, so standard MAPD plans, your Health Choice PPO and our Select HMO will have a flex spending card in both of our dual plans.
Do you recommend that people go in to that website, log on, and just, create an account? I did that just because I thought it was important. I created an account somewhere for my plan. So
I think it's definitely important. I mean, there's a lot of extra resources that you have available to you. I mean, it can help answer a lot of questions. That way you don't have to wait on hold with customer service or anything like that. I mean, you can get a lot of your answers right there. Because when you do log in, it already knows what plan you're on. So when you go to find a provider, it's going to search for the right network. Because we have so many different networks. For Blue Cross, I mean, we have Medicaid, group health plans, individual health plans. So when you log into your account, it already knows, okay, this person's on the Health Choice PPO. This is the network that we need to search, and that way it pulls the right providers for you. So no, it's definitely to have that.
it looks really simple. It also has those little subcategory things that you can click for whatever you're there for. I have another question relating to, and I have the Health Choice Plan PPO. I have I used to call it a flex card, but it's through HSA Bank. And can you tell me a little bit more? I mean, do I have to put money in that? How does this start through the benefits debit card?
Yeah, so no, what it is, it's a prepaid MasterCard that Blue Cross, we put $1,000 on there. So you can't add or anything. It's not a health savings account like the HSA that you had. So it's separate from that. This is basically just like your own money. Again, it's on a prepaid MasterCard. It's $1,000 already on it as of January 1st. So what not the downside, but I mean, the only thing to it is that you can only use it on dental, vision, and hearing services. And what I want to make sure members understand is that when you go to a vision provider, you don't have to use it on services that are covered under your plan. You can use it on anything related to vision within that vision store. As long as they bill that way, as long as they bill as a vision provider, you can use it there. I've had members that go in and they purchase them some nice Ray-Ban sunglasses or some nice lenses, like transitional lenses, things that maybe aren't covered under a medical plan. You can use that because it's your $1,000.
Okay.
So no.
But I can use it if I just went to the dentist and needed a crown, and maybe there's a waiting, I assume there's a waiting period, and I didn't meet the waiting period, I could still like buy a crown.
No, there's no waiting period on your plan, so you don't have waiting periods on your embedded dental benefits. So yeah, you won't have to worry about any kind of waiting period. And the $1,000 flex card, you can spend that as of day one. So as soon as you're active with us, you can start using that flex spending card.
So even something somewhat cosmetic like teeth whitening, they could use
Yeah,
$1,000.
Invisalign has been one that's came up. Implants. So dental implants are not covered on our MAPD products, but on the flex spending card, you can technically use that $1,000 towards a dental implant. It's something that does come up a lot. Like I said, as long as they're a dental provider, you can use it on anything that's related to dental within that office.
And so the Health Choice has $1,000 of embedded dental, right? That covers 100% toward preventive, and the member pays 20% toward major work like a crown.
Yes.
And so then the $1,000 flex card could be used to pick up
They're 20%.
your 20%.
Exactly. Same with the HMO Select. Anyone that's on an HMO Select plan, it's $2,000 of embedded comprehensive dental. So that 20%, you can use that $1,000 flex card to cover your 20% on that plan.
Okay, and it's good for that year, right? This is an annual thing?
Yes, calendar year. So it's good until December 31st.
Thank you.
Thank you. Good question.
So we will be sending this presentation to everyone who's joining us on Zoom. So please, I'm sure you have your email to us, so we are sure to have the correct email. Any other questions that anyone has? Looks like there aren't any questions, but so we're going to end this meeting. Thank you to John Romero.
I have one last question.
Okay, please.
When you get the answer on the MD Live telehealth thing, can you also email that out?
Yes, yes. So you've emailed that question. Is that right, Denise?
No, I didn't email that question there. I don't have.
Sorry, just send it
I don't have.
in the chat. Send your concern in the chat and we will pass it along to John Romero.
Thank you.
Thank you. So thank you, everyone. And if you do have other questions, you're welcome to email to me, Chris at Covell Consultants, or Mark at Covell Consultants. And we're here the whole year long to answer your questions and help you to make the most of your plans. Thank you for joining us, everyone.
Thank you. One question just specific to